City Syracuse Summer Tour. Today we're at Sankofa Center. Come on in. Hi, SeQuoia.
Hi.
How are you? It's so good to see you.
It's good to see you,
You know
too.
what? It's been forever.
I know.
And way too long.
Yes,
so let's not
the
let
last
that
time we saw each other, we was quite having a good time.
Right, we were. So I'm so happy to be down here because I've actually never been in this space before.
Mm-hmm.
I've been to the cafe, Sankofa Cafe, but never to the center. So I'm really happy today to talk to you about Sankofa Center, what you have going on here, resources, events, that kind of thing, and just learn more.
Okay, yeah.
So let's dive right in.
Let's start right in. So we are housed here in the Southside Communication Center. Our full name is the Sankofa Reproductive Health and Healing Center.
Gotcha.
And people call us Sankofa Center, Sankofa Heals. We got a couple nicknames in the community.
Yeah.
And really our mission here is to help reduce, illness and death in the Black community. We specifically have been organizing together and doing work for several years, but in 2020 we were just like, we need a physical space. We need to house all of the programs that we are doing together. So the center was co-founded by Doula for a Queen, Village Birth International, and Zenji Yoga. And we have a lot of programs. So our main focus is doula care. We provide full spectrum doula care to people who are seeking to become pregnant, currently pregnant, postpartum. We also offer abortion and miscarriage doula care as well.
Well, let me ask you before you go on. So how does that work? If somebody is interested in doula care, how does that work? How, what's the payment schedule like? How does that work out for women?
So all folks do, most folks will schedule a free consultation with us. And then after that, we talk with them about what the services entail. And then if they decide they want to move forward, our services are free to the Sankofa family. So we typically tell them that they have the option to give a love offering or a tip to their doula. But we compensate the doulas for their time and their labor. And so it's at no cost to the community. And so all they have to do is just call us and let us know what type of support. And I typically, myself and our advisor, Astaire, works together to make pairs with appropriate doulas.
That's insane. Like, that's such a phenomenal resource.
Yes, we really didn't want, historically doula care has been looked as like a luxury, something for, white affluent women. And we were like, this is our care. This is ancestral. For centuries, women have cared for other women, laboring people, birthing people. And so we really didn't want finances to be a barrier.
And so, does the doula work with the woman as she is pregnant, or does she just come in at the end when she's ready to give birth?
So we are there to support them throughout the pregnancy. So we provide prenatal care, so that's during their pregnancy, and then we're there at the time that they deliver. If they want virtual support because they want like their family and their partner there, then we'll provide virtual support. But if they're like, no, I want my doula here present, we're there at the hospital, we're there at the home. So it's really, we are community based, so it's like we show up where the client feels is most appropriate and needed. And then after they give birth, we provide postpartum care. So we're going to their house about 3 to 4 times to make sure that they have what they need and they're transitioning into that phase pretty good.
Right. Wow, I just wish that, when I was having my kids back in 2014, 2013, 2016, this was available because I already know the benefits of having this kind of service. And I actually had a midwife, but again, a doula would have been fantastic.
Just having somebody in your corner, to answer questions and just... doctor's appointments are typically 30 minutes tops. So
I was gonna say sometimes not even that long.
Exactly. So it's really important for people in our community, especially as Black folks who are navigating misogyny, navigating racism, that they have someone they can talk to for beyond 30 minutes to get answers for their care.
I think about especially young women, having their first child or not, being able to take advantage of this kind of experience, this kind of resource. So how did this come about? Because I heard a collaboration between 3 different organizations. I don't know if there was any other funding that was, brought into the mix as well. But tell me about the vision and how it came about back in 2020.
Yeah, so I believe it was
before
about
the pandemic,
2019, before. So
wow.
about 2018, Village Birth and Zenji Yoga and Doula for a Queen have been doing some collaborative programming outside of Cafe Sankofa. So that's why a lot of folks still associate us with Cafe Sankofa besides our similar names. So we were doing writing workshops. We were doing childbirth education. We were also doing just like yoga and movement and wellness events throughout Sankofa, Cafe Sankofa. And so once we were able to, the biggest thing is that after the George Floyd case, many folks were like, we need to be able to invest in community-based organizations and Black folks who are doing this healing liberatory work. And so we were awarded $50,000 from the Community Foundation to open the physical space for Sankofa Reproductive Health and Healing Center.
Very nice.
Yeah, so we've been doing this work. I mean, before we were doing the collaborative work, I'm a doula for a queen. That's myself. I've been working with Village Birth International since I was trained back 8-9 years ago. So it's always been a collaborative work, and then and we have Village Birth International has trained majority of the Black birth workers here in Syracuse, and so we just wanted to have a way for folks to have support and to be connected to doula clients.
Mm-hmm. So you told me about the activities and the initiative where you have doulas work with mothers. Mm-hmm. What else do you have going on? What other kinds of things does the center offer to the community?
So we also have our Wellness Wednesday initiative. So every Wednesday, community members can come and receive completely free diapers, wipes. We have menstrual products. So we have Diva cups, tampons, pads. We have clothes from infant to adult for women and men. And we also have so much, I can't even think. Yeah. Shoes. So this is just we're in the Sankofa district. The Sankofa district, historically was one where there was a lot of mom and pop shops. It was economic viability, and then what we see is there was a decline in the economic viability of the Sankofa district, and so many people in this community, I live below the poverty line, and they are struggling, right? So we want to make sure that there is a place that folks can go to on the Southside, especially with it being a food desert. And also just not having access to things of the nature, or having to deal with discrimination, or having to decide if they gotta steal diapers from Family Dollar or struggle, right? So we want to be able to use our services to kind of reduce police interaction so that moms don't have to feel like they have to steal formula. They don't have to feel like they can come, and not saying that that's what they're doing, but we want to help encourage, empower people to have their resources and not have to stress about how they're going to survive the next week or next month.
I keep saying, I am kind of blown away a little bit. First, because I didn't know all of what was done down here at the Sankofa Center. But just to know how many people that you're helping in this very community where people need it the most.
Yeah, and we serve that resource. I think last year we probably served nearly 400 folks virtually. Wow. So we had childbirth education classes, which are community based. So historically they've been taught by myself, but as we are growing our staff, other birth workers are getting experience with providing lactation support. So we do have 2 lactation peer counselors, and we also have 2 lactation consultants who support and provide support through Sankofa. I tell people we kind of do it all,
It sounds like it.
Yeah, and reproductive health across the timeline. So if a woman has fibroids and they're like, my doctor telling me to get a hysterectomy, I don't want to get a hysterectomy. Is there someone I can talk to? We have Astaire who's helping to provide reproductive health counseling, period, to make sure that people are receiving the proper information to make informed decisions about their reproductive health beyond pregnancy.
Yeah, because there's a lot of that too, especially for Black women. When you mentioned fibroids, my ears kind of perked up. Because typically we would just go to our doctors and get one source of information and maybe do a Google search. Exactly. That might be a little dangerous itself, right? But to know that you have a resource down here too, informed nurses, health professionals that can offer maybe even alternatives to what may be provided by a doctor's office.
Exactly. And that's what we're here for, you know, just to make sure that, like you said, a lot of folks will go on Google and then they send themselves into an anxiety tizzy. So we, you know, and like you said, like I'm a nurse. Esther's a nurse. Latisia, who's one of our lactation counselors, she's a nurse as well. And then many of our doulas have an extensive experience in working in reproductive health, maternal health, things of that nature.
Wonderful. That's awesome. So do you find that the community is aware of this? Mm-hmm. Do you think that they're well aware? Do you think there's more to do in terms of spreading the word and making more people aware? Where do you feel like you are with that? The center is with that?
Yeah, I think that we definitely have had an increase in awareness.
Good.
That we've for Black History Month, we were featured by News Channel 9, so we definitely saw an increase in people seeking out our services.
Good.
And then we were also featured on the News Channel 9's Wellness Wednesday program, and so most folks find out us through like 221, or is it 211?
211.
Yeah, 211. Yes. And then we, you know, everywhere I'm going, I'm spreading the news. So I'm like, I'm stopping people.
And I will
Look
too.
at our Facebook. Mm-hmm. Like, you got a moment. That's what I do. I see Black pregnant folks walking around, and I'm like, can I talk to you for a second? I feel like I'm evangelizing. But so, you know, we definitely, I think that, you know, folks are like, I can't believe this is right here. We have people walking from their house. Like, you know, they don't have to catch a bus. Right. They don't have to find a ride. Many people are just able to walk down here, get what they need, and go back home.
Mm-hmm. All right. Well, you talked to me about the history of the Sankofa Center, how it came about, the resources, the initiatives, the events, the supplies, like all of this stuff that you have going on. Tell me now about the future of Sankofa Cafe. Where do you see it going? What is the vision going forward for the cafe, and how can this community and others help?
Yeah, so I mean, I definitely think that our vision is to do more community collaboration. So, you know, because of our relationship with Cafe Sankofa, we will likely continue to partner with them, especially with their wellness initiative. And we're also just hoping to, especially with Roe versus Wade being overturned, and there being a lot of just uncertainty around how this will impact us here in New York, even though New York is still legal, we're just really focusing on building our coalition. So we have a Black Maternal Health Justice Coalition, and that's just made up of a bunch of black birth workers, you know, medical students, nursing students, just people interested in advancing maternal health. So our focus is going to be on really building coalition and building collective power to make sure that we are able to hold institutions accountable. So right now, you know, many people are giving birth at the local hospitals and are not having positive experiences. So we're really focusing on seeing how we can use our position in the community and the experiences of our clients and our doulas to help advance some change on the institutional level, as well as being involved in efforts to get, you know, New York Health Act passed, and also increasing access to home birth midwifery practices through this certified professional midwifery bill. So we have our direct outreach, direct community program, and then we also have our policy initiatives that we want to help encourage the community to get involved in, because, you know, what we've learned is that our voices matter. And when we come together behind a goal, behind a mission, we're very powerful.
You are so right about this, and this is such a powerful center with all of the things that you have going on here. I'm so thankful for the work that you do.
Thank you.
Yes, absolutely. So, Leandra, tell me all about Wellness Wednesdays and what you have going on in this space.
So this is a space, like you said, it's called Wellness Wednesdays. Every Wednesday you can sign up. You can go on our website, our link tree, which is sankofahills.com. You make an appointment and you come in. So these are all free items for any moms or anyone with kids, pregnant, not pregnant, anyone that's in need. So we have free diapers, wipes, clothing, formula, baby food, even female products, tampons, pads. We even have condoms. So just any free items that you would need for you, your family, kids, anything like that. So
that's great. So it's every Wednesday
of
the week, and can people come in multiple Wednesdays during the
month?
So
if you want to schedule an appointment every Wednesday, you can.
Oh wow.
Yep.
And this is a free resource.
Yep. And it's mostly all donated items as well. So
okay. Yeah. Wonderful.
Yeah.
I'm so happy that you have something like this in the heart of the community, where people can come down and get some of the supplies and things that they need to support their families.
Exactly, because it's hard. Sometimes we don't have access. So having it here in the community is what we want. So, yeah.
Absolutely. Yeah. Thank you.
You're welcome.
So before I get information on like how to find Sankofa Center and all of that, hook up with you online, social media, all the places, I'm going to do a quick round robin.
Okay.
So what I want to do is I'm going to say a word, and you're going to tell me the first thing that comes to mind.
Okay.
Okay?
Oh, Jesus.
Black women.
Powerful.
Good one. Birth.
Life-changing.
Syracuse. Sacred. Awesome. Very good responses.
I see people have feelings about Syracuse, but I think we have a rich history, just the abolition history, the freedom. Like the Syracuse was a vibrant city, and I just like always trying to remind people of that history.
And we're gonna get back to that. All right, so tell me how to find Sankofa Center and how to hook up with you.
Okay, so we are located at 2331 South Salina Street. We are right next to Cafe Sankofa. So we always try to tell people we're in the orange house right next to Sankofa, Cafe Sankofa. People can text us 315-920-2787. We have a Facebook page, Sankofa Reproductive Health and Healing Center. We also have an Instagram, Sankofa Heals, and we have a website, www.sankofaheals.com.
Very nice. Well, it was so nice talking to you
Thank
today.
you so much.
We'll be getting together soon.
Okay.
All right. Take care.